Hi everyone, so this is my Module 2 developmental assessment for toddlers. So the toddler that I will be assessing is the little boy that I nanny for named Benny. He's currently 21 months and he'll be turning 2 in January. I've been watching Benny since he was 4 months old, so I've been able to watch him change and develop over the last year and a half. In terms of physical development, Benny's always been a big kid, so he was at his 18-month checkup 99th percentile for height and 98th for weight. Now that he is more active, I've noticed that he's slowly but surely starting to lose some of that baby chub, and then as he gets older, he's also getting taller and more lean. Along with changes in activity level, he recently experienced a change in state of arousal. At the beginning of the summer, he was taking 2 naps a day, one in the morning and one in the afternoon. However, in July, when he turned 18 months, that was right around the time that he transitioned to 1 nap a day, which is common for kids to have a change in nap schedule at this time. So as you can tell from that video, Benny is very active and he's always on the go, which explains the changes in state of arousal as well as the change in his body composition. Physical development, like all areas of development, could be greatly impacted due to hospitalization. One area which could be especially important to observe as a child life specialist would be the patient's nutrition. Proper nutrition during toddlerhood is crucial in ensuring growth and development. As toddlers begin to cut teeth, they are able to transition from baby food to more normal nutrient-dense food. However, hospitalization can affect this in many ways. For example, specific medication might cause a toddler to lose their appetite. Another one could be if they had a diagnosis that affected fine motor skills. This might prevent a toddler from feeding themselves like they once did. This can lead to a lack of control and leading to toddlers acting out as well because they don't want to be fed by a parent or caregiver. As a child life specialist in the hospital, to observe physical development in patients, I could observe and track their eating patterns and habits. This will allow me to assess their physical growth and development in continuing even through hospitalization. When assessing Benny's cognitive development, the 2 biggest milestones I noticed were his attention span and his language development. For toddlers, as plans and activities gradually become more complex, the duration of attention increases. I noticed this with Benny throughout the summer. For example, when we would go to the library, they had a bunch of toys and instruments that he enjoyed playing with, and by the end of the summer, he would pick them up and play the instrument for like 5 to 10 minutes, as opposed to at the beginning of the summer where he would beat on the drum once or twice and then would move on to the next toy. The second aspect of cognitive development I observed was his developing language. At 18 months, Benny could say mom and dad, and he made some different animal sounds too. At his 18-month checkup, the doctor said he was in the normal range for language development, but she hoped he would start making more words and starting the string together of 2 words like we discussed in class. However, we did know that he had language comprehension because when we would say things to him like, Benny, we're going to the library, go get your shoes, he would know to run into the living room to put his shoes on. He also was using sign language to communicate words like more, please, and thank you.
Benny, what's the letter of the day?
Cognitive development could be affected with this age due to hospitalization. This age is susceptible to struggles because they don't always have the right language to express how they're feeling. Cognitive development can be stimulated through music and dance. So one way that I could observe as a child life specialist would be playing head, shoulders, knees, and toes with the toddlers. Since this is a common song, many toddlers know it, but if they don't, it can easily be taught by asking them questions like, where's your head? And then they point to their head. The song allows the toddlers to begin to connect the language and words of the song with their physical body. It can be a good assessment of where the toddler is at cognitively based on their response and if they're able to make those connections between words and actions. Observing Benny's emotional development is most evident when examining his attachment style. At this age, he has developed a clear-cut attachment, meaning attachment to the familiar caregiver is evident. He has noticeable reactions of excitement when his parents come home from work. He'll usually gasp and run to the door to give them a hug. However, he doesn't necessarily show signs of separation anxiety when they leave, and I think it's because I've spent so much time with him that I'm also a familiar person in his life. So while he doesn't have the attachment to me like he does with his parents, it's not necessarily a stranger coming in to watch him. He also, at this age, has began to formation of reciprocal relationships, so he starts to understand the factors that influence his parents coming and going. Hospitalization can have a significant impact on emotional development in toddlers. In general, I think it would be important to encourage as much family involvement as possible because the attachment to parents and caregivers has already been formed at this age. One way to observe this as a child life specialist would be to notice the toddler's response when parents or caregivers leave and come back. The toddler's reaction and response will allow me to assess the type of attachment they have with their caregiver. For example, in a secure attachment situation, I would expect to observe the toddler to demonstrate drastic changes in behavior upon the parent's return. Most toddlers who are securely attached will express joy, will want to be held, or will have their crying subside when the parent returns. If this sort of reaction is not present, in my observations, the toddler may have an insecure avoidant, insecure resistant, or disorganized attachment style. In this case, it would require child life intervention and collaboration with the parents in order to continue emotional development for the toddler. When looking at social development for Benny, the first thing that stands out to me is the temperament category in which he fits in. I could easily describe Benny as an easy child because he quickly establishes regular routines, is generally cheerful, and adapts easily to new experiences. For example, when he went to daycare for the first time, his first day he was a little bit more shy and hid off of his mom, but by the second day he was sprinting out of the car through the parking lot and was ready to go to daycare and to see his friends and to play on the playground. Benny is also a very social kid. He is an imitator, loves being the center of attention, and isn't afraid to explore new environments when he has a secure base, whether that's me or his mom. So in the next video that you're going to watch, his dad spits and Benny also copies it, and then when his mom laughs, he starts laughing because he picks up on the social cues. Whether a toddler is naturally social or not, hospitalization can still disrupt social development. In order to promote social development, I would ensure that if a child was not in isolation, they had plenty of time to explore and play with other kids. In particular, they could be in the playroom. Toddlers play in many different ways, but the most common for this age are solitary play, onlooker, and parallel play. Parallel play is important for social development because it may seem like there's no interaction between the two toddlers. However, they are actually interacting because they are aware of the other child and they're paying close attention to what the other child is doing. This helps set the groundwork for their play in the future. So as a developmental assessment of a toddler's social skills, I could observe how they play. This would give me an idea of their temperament and reaction to other kids, which would help me assess where they're at in terms of social development. According to Piaget, at 18 months, Benny would still be in the sensory motor stage. In particular, he would fall into the sixth substage category, which is mental representation. In this substage, he begins to understand invisible displacement as well as participating in make-believe play. One way over the summer I observed this was trying to hide one of his toys. Benny has a bunch of toys that all make noises and sounds, and they drive me crazy when they go off all at the same time. So he has one of those alphabet buses like you see on the picture, and when he walked into the kitchen, I took the alphabet bus, turned it off, and put it away in his toy chest. However, when he came back, although he didn't see me hide the bus, he looked around for it, and he looked in the toy chest and ended up finding it. Benny also acts out make-believe play by playing one of his favorite games, Concession Stand. He learned how to open up the beverage drawer in the fridge so he can pull out all the drinks, and he lines them up in the laundry room. He did this all summer long, so at the end of the summer, his mom got him a Fisher-Price food truck, and he uses that now as his concession stand. Toddlerhood is interesting, according to Piaget, because toddlers fall into two different categories: sensory motor and beginning of the preoperational stage. In the sensory motor stage, toddlers are experiencing the world through their senses. However, with preoperational, they begin to represent things in their world with words and images. This occurs with the development of language. However, in the hospital, this is drastically interrupted because the world as they once knew it is suddenly changed and replaced with unfamiliar. One way to assess this in the hospital would be to ask toddlers where certain things, people, and objects are and seeing if they can identify them. For example, if a toddler's shoes are sitting on the chair, asking them, "Where are your shoes?" and seeing if they can point and find them. With this assessment, it would be important to only include things that they would find in their normal everyday life and are things that they would be able to recognize in order to understand that you're not confusing them and that you can tell that they are making the connections between the word and linking them to the object. Lastly, according to Erickson, Benny would be in the second stage, autonomy versus shame and doubt. This is the conflict of toddlerhood, which is resolved favorably when parents provide young children with suitable guidance and reasonable choice. Both his mom and I practiced this with him by always presenting him with two choices. For example, getting him dressed in the morning, I would hold up two different shirts and he would point to which one he wanted to wear. The same thing for snack. When it was time for a snack, I would hold up applesauce or yogurt and he would get to choose. So, along with this, one big thing I observed with choice was Benny wanted the choice of me feeding him or getting to feed himself. This would vary depending on the day, but I would hold out the spoon or fork to him and he would let me know if he wanted to do it himself or have me do it by just opening his mouth and having me start feeding him. But this allowed him the freedom to be independent while giving him safe and reasonable limits. Especially when hospitalized, toddlers need the independence and structure that Erickson's stage of autonomy versus shame and doubt provides. Hospitalization often leaves toddlers feeling a loss of control and normalcy with changes in their routine. Because of this, for development to continue, it's important that toddlers learn to exercise will and do things for themselves, or they will begin to doubt their abilities. So one way to assess development in this category would be observing potty training if that's something that the child had already pre-established before hospitalization and had mastered before hospitalization. For example, if a child was completely potty trained prior to hospitalization but began having accidents in the bed, this is something I could observe. Their response, however, is important to note because if they show no remorse or aren't noticeably upset by it, it's probably regression as opposed to shame and doubt. But if the toddler is embarrassed or is crying, then this is something to address because they are clearly feeling things of shame and doubt, and so it would be important to have a child-life intervention where feelings were validated and ensuring that punishment for the accident was not given. So I know this video got pretty lengthy, so if you made it to the end, I just wanted to say thank you so much for watching, and I'll see you all later.